Okay, good morning. This is an academic service learning project PowerPoint presentation presented by Dila Jospetri, Cheryl Chobel, and myself, Luis de Velasco. This is for the class NUR 3167 Nurse Scholar. The purpose of this project is to educate healthcare professionals about the importance of evidence-based practice in the nursing profession. Nursing has evolved through time, and the demand for professional knowledge and quality care has increased. In the same way, nursing autonomy and accountability have. In order to standardize healthcare practice with science, evidence-based practice appear to close the gap of what nurses do and what nurses know. In addition, the project explores available resources where nurses can find the latest research in order to ensure quality in nursing practice. This is the hospital George DiMaggio that we did the presentation. Nurses' practice is based on tradition. Through time, nursing has developed ways of doing things that have continued to practice. By authority, things done in certain ways because a physician has recommended a particular way to do it. By experience, has also provided a way of decision making, and scientific rationale. That's the logical reasoning and application of research finding, which become the focus when giving care. Evidence-based practice began due to the increased responsibility of nurses' action, a professional demand for accountability in safety and quality, and the gap that we have what we know and what we do. Evidence-based practice is the integration of research evidence with clinical expertise and patient values. These three elements conjugate. The research evidence represents the knowledge, the clinical expertise is the experience of the clinician, and the patient value represented by the patient choice. The steps of evidence-based practice. The first step is to frame the clinical questions which arise from clinical curiosity that is transformed into a question. Of course, there is a need to understand what is the clinical issue. The second step is the search for the best evidence. Finding the right information usually requires more than one source. When searching for evidence, all the sources should be considered. Clinicians might use peer-reviewed research. Of course, we need to practice caution because some of the information could be biased. The source of the evidence should be preferable from a database of published studies. Clinicians need to choose the right database that will help them to get the evidence to answer the question. Knowing how systematically search is essential for quick collection of information. The third step is to critically appraise the evidence, which is the identification of the study, the validity of the study, how reliable is the study, and the relevancy of the study, how it's going to be applied into the clinical practice.
Hi, I'm Cheryl Trowell, and I'll be continuing the evidence-based practice steps, beginning with the fourth step. The fourth step is to integrate the evidence. Once the best evidence is obtained, the integration involves institutional approval, planning the process for change in practice, and implementation. In addition to all these factors, we need to consider clinical expertise and patient preferences. The fifth step of the evidence-based practice is to evaluate the outcome, to see if the changes are effective in a particular patient or a type of setting. It is important to determine and document the impact of the evidence-based practice change on quality and for patient outcome. If the change of practice did not produce the same findings as demonstrated in the research, the clinician should ask if the intervention was administered the same way it was delivered in the study. The sixth step in the evidence-based practice is to disseminate the results. The clinician should share the positive outcomes obtained. One example used in nursing for evidence-based practice is the A-STAR model. And the A-STAR model has 5 steps, and after the steps, the information is going to be used for clinical practice, to be integrated into clinical practice.
Hello, my name is Dila Hospital, and I'm going to be covering the different resources that are available for nurses and healthcare professionals to guide their practice. First, this picture shows a pyramid, and it starts with the background information and expert opinions. Then talks about research articles, evidence guidelines, evidence summaries and abstract, and specific reviews and meta-analysis. I'm going to go over each one and give some examples of database that can be used to access that information. First, there's research articles that a lot of us use. Research articles they provide different information based on research studies. It's recommended usually to perform individual evaluation. There's PubMed, which is a very popular database, and SINAHL. Also, there's guidelines. Guidelines are designed for specific situations to facilitate practitioners and patients in choosing appropriate healthcare practices. They often come from authoritative professional organizations and associations such as AWHONN. Again, we can go into PubMed. We can go into the clinical guideline clearance houses, which has a bunch of resources on different guidelines for different specialties. Next slide. And then there are summaries and abstracts. They allow clinicians to gain an idea of the study at a glance. We have up-to-date clinical evidence, Nursing Reference Center Plus, and Dynamed. There's also meta search engines, which is a search engine that looks at multiple search engines simultaneously and combines the results. Again, there's Trib database and some search too, as an example. Then finally, we have the systematic reviews and the meta-analysis. Systematic reviews focus on specific questions and collect an important number of quality research evidence related to a specific subject. It covers a small number of subjects because it requires a significant amount of time to perform the research. So we have Campbell Collaboration, which is one database. There's SDSR, which is the Cochrane database of systematic reviews, and also DARE, which is the database of abstract reviews of effects. And the meta-analysis finally uses quantitative statistics to deliver systematic reviews. Again, we can use the same database, the CDSR and the DARE. Thank you.